Dr. Baskis, we want to ask you first about a tweet the president sent out comparing the coronavirus to the flu. I want to share that with our viewers. The president wrote, "Flu season is coming up. Many people every year, sometimes over 100,000, and despite the vaccine, die from the flu. Are we going to close down our country? No. We have learned to live with it, just like we are learning to live with COVID." Now, Twitter has labeled this post misleading and potentially harmful, but it did not remove it. Facebook did remove it and said, "We remove incorrect information about the severity of COVID-19. So, Dr. Baskis, what do you think? Can you explain more about why this information is so incorrect and misleading or potentially harmful?
Well, we don't want to downplay the risk of COVID. And that's one of the reasons why I think some people might consider that to be somewhat harmful. There's no doubt that in many patients, the flu is a significant problem, as is COVID. But the chances of a person dying from COVID is not large, especially if you're under age 35. But if you're over 70, the risk increases dramatically. So to give people the impression that this isn't a health problem, I think is an extremely unlikely problem for us. And so the president's tweet is giving up some encouraging information, but it's not 100% accurate. So at this point in time, I don't think that's a helpful piece of information. What we really want to do is we want to enforce the idea that people can be safer if they abide by the practices as proposed by the CDC. What are they? The same thing that we've had for the last 7 months, which is social distancing and wearing a mask. Those are the two things that will help us get through this until we have a vaccine. But that tweet wasn't a helpful tweet at all, no.
Dr. Baskis, President Trump also announced on Twitter that he will attend the next presidential debate October 15th. Do we know if he will still be contagious by then? We still don't know the last time he tested negative for COVID.
Right. So if you look at the data that we have, a person who's got an active infection with COVID is theoretically can still transmit the disease and is still communicable. In other words, can give that COVID to somebody else within about 20 days. So the closer you get to 20 days, the safer you are. But at 20 days, that's considered to be the remotest point in time when you still can transmit the virus from an infected person to another person. So the 20-day limit is what we believe is the safest answer to that question. And I'm not sure when the next debate is scheduled, but 20 days from the time that he was last symptomatic, not when he developed the disease. So if he was last symptomatic on Saturday, you can do the calculation 20 days from what Saturday was, and then he should out of the woods at that point in time.
Yeah, less than that with October 15th as the next date.
Right. Dr. Arnold Baskis, thanks so much. We appreciate it.
Thank you. Have a nice evening.